Hello all, Dr. Fox here with you. Thankfully, I'm starting to look a little bit better than I was. I mean, I'm still a little inflamed. I'll go into that in a little bit. I thought I'd do my 6 week check-in, or just sort of like a 6 week where I'm at with the surgery right now, and just kind of take a few minutes to kind of look back at things and kind of see where I'm going, and just share with you a little bit kind of with my thoughts about this, and kind of where things are, how I'm feeling, kind of where I'm at physically, mentally. We'll get into that, shan't we? Dr. Fox back here with you. Not a weekend update. Almost the weekend. I'll be glad when the weekend gets there. I usually don't get to go out to movies. I'm very, very excited. I don't get to like dress up really nice or anything very often. So, and I know I'm feeling a little self-conscious because I don't know if you guys can see it, but there's, see, I'm vicariously putting it right there to hide it. This is what I always used to do to hide things. But you can probably see it better now. Look, I feel like the Bride of Frankenstein. This is her. I've been putting scar tissue. I wish I had a surgeon that could like move tissue from one area and like cover up the scarring and get rid of every single one of my moles. I know they make us or who we are, but that's not my point. It's just how I feel inside. There's this dysphoria of things. I mean, thankfully, this dysphoria has gone away, but I'm still got my voice dysphoria. I've still got, and thankfully, most of the face dysphoria. I'm coming to terms, and I'm figuring out what it feels like in this new, almost like the mask has been taken off after spending over $100,000 to have this mask removed, and I'm starting to look a little better. Now I'm starting to see where people are like, oh, wow, Dr. Fox, you look great. I'm like, I don't see it yet. And I think as the swelling's beginning to come down, I probably look even better without my glasses, so I've been told. I'd like to find some like the bigger round frames, because now that my contouring of my face has changed a bit, I've got to get some different frames, because I put these on and I don't quite look as bad as I did. But and I'm not saying, it's just everybody's own eye of the beholder. And I know many of you are going to go, oh, geez, Dr. Fox, don't be so hard on yourself. You didn't look that bad at all. But, that's easy for others to say when that you're not living in the dysphoria of this whole thing, So Mora's here laying next to me. Hey, my babies. So I was just trying to tidy up and clear up. So like I was trying to say, this is still that's probably the biggest scar. I know some of that's supposed to be covered when I have more money, and we're gonna move the hairline up further. They're gonna move what I like to call the bulbs. I don't know how many of you know this, but not just being a doctor, RN, CNA, and so many other things I've trained for, is they like to call me, I should have like the little heading over my head, like Jane of many trades, right? But I'm a licensed cosmetologist too, and I know that when it comes to the bulb, and the bulb's are going to be removed, and of course, any of you that understand anatomy know that those nerve endings that come out, there's a little I knew the word for, see, I'm saying that right. I'm like, oh, professional, and then I'm like, I forgot the word, right? Anyway, it's the canal, or not the canal, but the area that the bulb is in, and these little nerve endings come up, and they touch your bulb, if you will. That's the name of the end of your hair follicle. And that has a very thin tube, so it's almost like a birth canal, and it's sort of coming out, pushing and feeling weird. I just hope they're going to use local anesthetic. So I've been told, but shot local anesthetic with needles, not. I've had laser treatments and electrolysis at least over a dozen different places. And they wouldn't use local anesthetic. They said they do, but all they give you is this numbing cream, which ends up making my lips numb. I was trying to create the sound of kind of what it sounded like when that would happen to me, and I'd start to drool a little bit because I can't control that. And that's a lot like getting your mouth numbed. But I'd have that numbing cream sitting on my face for like an hour, and it wouldn't go deep enough. It would just numb the skin. It wouldn't get down inside the follicles as they're getting blasted. So I don't know who. Now, look, everyone's DNA is different, and I know everybody's pain tolerance is different. I've had to go through so much agony, so much pain, and so much more. And I have a sensitivity in, especially the areas that are much more sensitive than other areas. And of course, they end up working in these very sensitive areas. And some people are like, oh, it's just a snap of an elastic. No, it's a lot more than that. It's like a freaking needle just stabbing you over and over and sticking it in there like a freaking inch in every time. And it's painful. It's agonizing for me every single blast, and we're supposed to do this for like an 8 hour. 8 hours. I can barely get through, a half hour, 45-minute session, and and I can't take a Valium. First off, usually I can't afford it or get it prescribed. Secondly, most of the time I'm driving, so I can't do it. I might be able to finally this time, but as long as I know I can go to a place that hasn't. So what I was leading back to here is part of their procedure is they're going to be adding my hairline lower. You're going to take the bulbs out, and then they're going to plug those in. They're called plugs, and they're going to start plugging those in. Like, I think I had paid up to 8 or 10,000 plugs, something like that. And that costs like $7,800. And of course, can get covered. This is why our world's broken. We need this stuff covered without problems like this. And it bothers me because we know it's a lot more complex than that. But anyway, so all I'm saying is when I go out today, I'm going to be a little self-conscious because people are going to be staring at this, even if I'm trying to hide it to the best of my ability. Thankfully, though, he does amazing microsurgery. Aside from that, I mean, that will be covered up eventually. Someone go, oh, put a hat on, but I can't. The rim is like right there, and it hurts, and it's very tender, and it's sore right here. I can really kind of feel, and it's still numb up here. See, nothing. It's very numb and sore because when they, yeah, is that better? I mean, that's what it feels like that they did, and that's from a Men in Black reference. But, and the scar tissue, this is fading a bit. I don't know how well you guys can see. I need some lighting or something. I should have brought my little light and give you some better lighting. But the scar's starting to fade a little. And I'm going to put some makeup on before I go. I just want to show you what it was like or how I'm looking without makeup right now. I don't Photoshop my photos. People that know me know I don't do that. I don't plaster on a lot of makeup. I wish I could afford those really nice eyeliners and really enhance my eyes better. I'm not comfortable putting on the bigger fake lashes, though with my, I wish I could kind of touch it. I had an eyebrow lift. That was part of the $86,985 plus to have eyebrow lift, and I'm like, it doesn't even look like an eyebrow lift. But he got rid of the squareness. He's got my face more rounded, more feminine, which is good. So I mean, I do look better as it's and it's not like I'm in a rush. I'm a very patient lady. Some suffer, and I know a young trans lady that's like a quarter of my age, and she's like, oh, I had to suffer 3 years. Now, I'm not saying that in a negative way, like I don't feel for her suffering. And I don't want this to sound what my reaction is going to be. And all I'm saying is, oh, I feel for you, hon, because I could sit here and tell you horror stories about the suffering. And it doesn't take away the suffering that we all have to suffer through. And some could lie and pretend and just go, oh, yeah, we all suffer. It's more than that. It's just when you start saying kind of statements like that, it starts taking away from all the pain and all the anxiety and everything. Or when they go, well, at least it's done now. And look, I know they're just they think they're saying better things. They can't be saying that. And then they can't be telling us to calm down, because that's the last thing you want to hear. And then you get more agitated and angry hearing someone say that. or don't breathe. And yes, I know breathing does help eventually, but I'm going to breathe on my time when I'm ready to breathe a little bit later. I have my way that I come down from all this chaos, but I'm just trying to share with you a little bit of where my mind will jump around on all this chaos going on while we're trying to process through this. And we know that the system's broken, and you can't just go, oh, must be nice, someone who makes, a quarter what I make. And not that I'm comparing, just sharing examples of this process. And what I was saying before is like, oh, I suffered for 3 years, she says. And I was like, look, I feel for your pain. I can definitely, someone here that can relate to you. But I'm like, I feel for you, but I almost want to say, like, without sounding negative, try suffering for over 40 years. Try 3 decades instead of 3 years. But even 3 years is a lot. I wish there was a program where you could pay for it after. We know the pros and cons. We know there's a better way to make this work, and too many people are too selfish, too angry, too caught up in their own religion issues, just their own lives. Many of them take for granted a lot of the little parts that are involved just every day. It's like me when I wake up. I've got 20 things going on to make sure that I can function or sound a certain way or hide something, and everyone else just gets up and they're doing their day, and they don't have to think about that, and they wonder why I'm so stressed. But that's just not the only thing. There's 20 other things going on top of that. And then when it doesn't help, when you get a lot of horrible, angry, pissed off people around you, which you try to avoid, and then you go, I want to get those out of my life. And then you do, but then you end up bringing in more that are maybe kind in the beginning, and then they start showing their true colors. You get really pissed, and you can't just keep, having some come in, push out, and then some go, I don't want to let anyone, if that's going to be what most, they're not all going to be that way. It takes time to get to know, and then what I wanted to say is then the next step is you got someone that goes, oh, I only had to come up with $1,000 and my insurance covers it. I have had 12 different insurances, they won't cover it, and we know times have changed, but we think times have changed to the worse again, and times are not changing. And I've looked, so a lot of people forget about looking at history because they want to put on their mask and see that because it worked for them and they found a magic word or a magic number or a person that put in some magic code to make all that go through, and she gets to have her surgery within 3 years of her transition, and I'm over here suffering. And it's not me making up excuses. It's not me, like I worked my butt off to get this far. I'm almost there. I got 2 more things I got to do. We've got 1 more throat surgery at the end of the month. That should, I can't speak for like 4 weeks, so that should hopefully take care of some of this voice struggle I'm having. But then you got your pros and cons. Then you got a lot of trans out there that have had it done, and it's like raspy, and they can't sing anymore, and they end up sounding different. And there's this negative issue with it, and then they try to talk you out of it because they're trying to encourage people to not be doing plastic surgery, well as a lot of other people that don't. And they don't realize this is a life-changing situation and circumstance, and we'll weigh our pros and cons. But for me, it's a dysphoria I need done, and others will think, no, you don't. You can just have voice lessons. I have had voice lessons. I have had things stuck down my throat. This is my last chance to get this straightened out. And then some will think, oh, no, it's not your last chance, Dr. You have some other options. No. They don't understand. I'm at my wit's end at this point, and this has to be done now for a whole list of reasons. I'm not going to get into it because I know no matter what I say, someone's going to have a rebuttal and think that what I say about it, isn't valid enough, and that there's pros and cons for all of it. So all I'm saying is just, you get that constant anger coming at you, and you'd think some people would go, well, they're trans. They've suffered. Half of the ones I talk to never suffered anywhere close to what I've had to suffer. And I'm not comparing, I'm just trying to share. And they end up not being compassionate. And a lot of these people, I'm like, are you trans? No. Or the few that are, like, they still have this attitude. And it's like, it's not needed for an attitude. We got to come together and show our support and love and compassion for one another. And I don't want it to sound like I'm sitting here dissing other people's victories in a short period of time over my negative long victory. That's not what I'm getting at. That doesn't mean I'm jealous or overzealous or any of that kind of stuff. I'm just sharing with you the chaos that gets pulled out. A lot of people go, oh my God, if I had to wait 30, 40 years, oh my God, I've been dead by now, or I'd revert back. I can't revert back. Like, why would someone go, okay, now I don't have cancer, but it's a form of cancer. And I'm like, if someone gets a form of cancer on their body, why would they choose, well, I can't get rid of this particular cancer or it'll kill me, right? And then they go, well, if that's the case, why don't you go back to having it? It's like you get the cancer removed. You don't want to put the cancer back on or have it regrow again. And some will think apples to oranges. It's not. If you look at the medical side of how this psychologically affects one another, there's a lot more similarities than a lot of people will try to pull stuff out of they'll just pull stuff out of their butt and they'll try to make it sound like their thing is nowhere near that at all. And it's really debilitating when we don't come together, and it's really upsetting when you got, lesbians and trans, and then you've got your very homophobic straight men that are like, that's just a dude, with breasts, and that's not what this is. It does, like, what's wrong with people? And you don't understand when you have someone that's born intersex, that's not male or female. And then when you are on hormone therapy for as long as I've been on hormone therapy, your body is reprogrammed, and it's feminine features that build all the way from the inside of your gut all the way out through all the layers of skin, recreating a woman's butt. So it's not a man's butt. And some will think otherwise. And they're like, well, it's still a man's butt. No, it's not. You give hormone therapy long enough, it's the same thing with a biological woman. We all are the same gender when we're still forming in the fetus. People don't realize that. And they forget they're just looking for these angry reasons to hate them just because maybe they got intimate with someone and suddenly they found out that someone has something else that they don't agree with, so they've now come to hate, or they've seen something else or some negative thing in media or some other person that they've met that was very agitated and angry. Now look, I've had a rough upbringing. I've had a rough life. But that doesn't give me white privilege. I've been treated just as bad. That's why I relate. I've had, I've had black girlfriends. I've had different race girlfriends. I've had just friends that are all different variants, whether you want to call it purple, polka dotted, striped, whatever you want to use it as a term. I don't, because we could relate a lot. And I can relate a lot to an individual that's been suffering like that because of a different color or a different race or and I can really relate to that kind of circumstance. And when people forget to sit down and have a long conversation about these things, they forget that we have a lot more in common than we don't. And a lot of people are just very angry at people, at the world, and a lot of other problems that we forget about. And they're quick to judge, and just because someone doesn't fit into somebody's quote-unquote version of how they define a woman, it just bothers me. It's like, why do we even have to, and then some, because of all that anguish, they're like, no, I want to be identified as non-binary. So they don't want, and I'm not saying they're all that way. I'm just saying there's always an exception to the rule for everything. I'm just using these countless examples of kind of where people go with it, because then it gives them a defense mechanism. But I'm not saying that individuals identifying that way use defense mechanisms. I'm just sharing with you that there are many reasons on top of reason on reason on reasoning why an individual has to process through something, and why so many outside sources we get suffering from constantly trying to make us feel like we're not allowed to transition, or no one's supportive of you, or if they say they're supportive of you, they're very angry about it. And they're like, well, I'm being supportive. Well, they're not very, very supportive with that kind of attitude. And if you know a whole list of things going on, and it doesn't mean you can't forgive and forget. It doesn't mean you got the devil coming into you or any of that stuff. That's all things created from the human brain that wants to use excuses and can't take blame for oneself. We've got to take responsibility for our own actions within reason, of course. And we've got to look at these things, and we've got to sit back, and we've got to try to figure out. And so with that all aside, I hope I can finally go out later this afternoon and have a little downtime to get away from the chaos. This is why I like going to cinema. And then someone will go, what about COVID? Look, I got both my shots. I got my booster. And then some of naysayers will already say, yeah, but they, have you seen the new variants? No, this booster covers 92.8% of all the variants so far. And look, I understand there's still that small microscopic bit, but I'm not sticking fingers in my mouth. I'm washing my hands vigorously each day. I clean my doorknobs. I wash down, I wipe down my groceries within reason, of course. I wash my food. I am very diligent about certain aspects, but I also don't go overboard either. But then those that aren't affected by COVID, they're like, oh, it's a bunch of hootenanny. It's like clearly they seem to have no human being connected to them that has any interaction with this. So they completely want to just pretend it doesn't exist and think once again that it's some conspiracy or something. And I'm like, okay, what conspiracy makes up over 4 billion people dead already? That doesn't add up. And then they have all these. Anyway, I'm just saying, with all that chaos aside, I wanted to share with you that was a bit of a struggle I'm sharing with. Thankfully, my nose has finally come down from, it was massively swelling. Now, when it comes to rhinoplasty, these tend to take about 6 months to a year. And let's give you a side view. Maybe it still looks a little elongated, but my schnoz used to be a lot bigger, and it still feels kind of like it is, but it's like I feel like it's been created more of this rounded, like thicker nose. It's a little, but this is much thinner. This used to be all square. They went in there and Dr. Spiegel even told me he grinded down. He said, we haven't had to grind down to your bone because the bone was shaping more of a square contoured face. And now it's a much more, he was able to rounded it, and recreated the schnoz. I didn't really want, I guess everybody's view of a button nose. I didn't really want I just wanted a cute little feminine nose. And I'm just looking at all these women. Look, I know some of them are photoshopped. I know some have all that extra money to get all that. It's a $1 billion industry, the makeup industry, and they're able to cover a lot of their. I don't like the word flaws. I think what makes them is them. I don't see those as flaws. I see those as unique parts of who they are. But then they'll use all that and they'll cover it. And so I look at those, and doesn't mean I'm looking online like when you look at a magazine or television and how it's all considered quote unquote fantasy. So you can't live up to that expectation. That's not, with that aside, that's not what I'm talking about. It's just and I know some of these, a lot of these women are half my age. And notice I'm giving them their proper pronoun. And I wish I'd get that because I'm getting tired of he. Okay, sir. I'm like, I'm not a sir. What the hell is wrong with you people? And they'll give excuses. Anyway, so with that, I'm looking at them and I'm going, well, my face doesn't look like theirs. And I know everybody's face is different and everybody's contour is different. And as we age, we're a little different. But I just, it gives me some references to look at. Usually, especially these days, microsurgeons can do some amazing work. There are folks I know that have spent money to look like other, celebrity lookalikes. So they didn't even ask me kind of what contouring I'm going or trying to look like. We didn't even get to have that conversation. She took a front, a slight angled view. I had my chin up, straight on side. And then I was just I was hoping for maybe a contour, like a button nose, but I didn't want that to be translated into some big, thick, rounded, schnoz either. I was trying to be some cute little feminine kind of nose. I said that will go with my contouring of my feminine face. Just, trying to help it look feminine. And yeah, I'm not complaining. It does. It looks when I look at it right, it does look more feminine than it did. I used to look very manly. Well, others would say you passed fairly well, Dr. Fuck. You don't look you'd look like a female, biological female, and I wouldn't have known otherwise if you didn't say anything. But that, that's what I'm saying. All these human beings are different. There's a handful that will say that. Then you've got a gay man who tells you sound like a gay man. And I'm not trying to sound like a gay man. I'm doing the best I can with what I have to work with. Others you talk to, they're like, no, you sound like a female to me. So it's like it all is, it's all varying. Then you got a trans that goes, I'm not going to hang out with you, because even though years prior she was like, oh, you're the physique that I'm going for. You're so beautiful, only to get her angry later on and go, oh, well, if you're going to sound like that, I'm not going to have people call me out on it. I'm not going to hang out with you because you sound like that. I mean, what a horrible, gross, disgusting thing to say to someone. I mean, that's horrific. No one should be treated this way. So there's still a little... So let me go over these here. Let me finish these up while we're having a discussion about the chaos that goes on in this world. The mental issues and attitude with these problem people. So it's not as bad as it's been. This was very inflamed before. And I look at my gum, it's still a little large in there, and I can feel this big thick dip on the inside of. Wish I had a better little camera I could show you guys. Well, some people would be grossed out by the inside look of people's mouths, but I keep mine very clean. I brush it, gargle, and floss 4 times a day. But that's a story for a different day. I keep it very, very, very clean. But it's it's a little sore in here. Still a little bit. I mean, after 6 weeks. Okay, there's the scar right there. I can feel this little bump. It's like having it's like this. It's like if you've ever had any moles removed before, or ever, it's got that weird, like, thick, almost like a leathery skin feeling almost. It feels kind of weird. And like I said, I'm applying every single day moisturizer and a scar gel. Some say creams work better. Some say, I don't know. I'm getting mixed reviews from everything I've looked at. I missed that $80 cream that pretty much made it go away. Like my own creator wouldn't know I've had breast dog. But at least I'll share that. A lot of people are like, oh, I didn't have it. And you clearly can tell that something else is going on there. Though other ones will say, no, that's just how they grew. Maybe you're lucky enough. But we know it's more complicated than that. There's pros and cons for everything. But so, and then it's very thin. Like, I go like this. Like this. I can feel, like, this feels very tough and thick. And I almost feel like because this is where the scar is. And I have to put a scar gel here. It feels weird because it's almost like I'm putting gel on, like when someone has a stuffed nose. Like, I'm still waking up and, like, one nostril's congested and one's clear, and then as I'm waking up, like, they'll flip, and then the other one's clear, and the other one's and I have a lot of migraine and sinus, but it's been a little better. It's still sore through here a little. I also haven't been sleeping properly lately either. It doesn't help. I did sleep a little better last night, but so this is, well, okay, this used to be really, really, really hard and numb. It's getting a little less. It still feels weird though. It's all, it's weird. I've got these big indents from my glasses. I also got to get a different pair because they're pushing on that vein right there. It's like, do-dish, do-dish, do-dish. It's so, I don't know. I'm trying to give you all a better angle, and I'm just feeling around and sharing with you. It feels weird because, like, I'll touch this inner area and it feels like there's this empty spot to my skull. It's weird. Like, I hope they didn't, like, cut into my eyeball, or they had to put something else in there. It's kind of weird. Like, this used to be really thick and hard and tough. Like I said, this is going to take about 6 months to a year anyway. So And then a lot of this other stuff's just going to take months away. But I just wanted to spend some time with you kind of on my 6-week update. Thankfully, we just got the email last night. I printed it out, but I was low on ink. I hope those are going to work all right. They'll probably just have me sign the paperwork when I get there again, with copies that are better. That's coming up. I think it's November 30th. And then I also called to set up for my COVID negative quick test again. That's happening, was it Black Friday? I think in a couple weeks. So speaking of that, I know some of the Black Friday deals have started. I hope some of you are able to enjoy some of those things. I know a lot of people are shopping earlier now because a lot of those ships are stuck at the docks and they can't get a lot of the product over here right now. But that's a story for a different day. And then supposedly China's building a whole bunch more nuclear, like we got to get rid of those. We got to stop having people, flopping around their you-know-whats to think that they got to toss that crap around at people. Like, we can't be having any more wars anymore. I'm not trying to say, we know it's more complicated than that. But that didn't help because I had a nightmare. I already have a lot of nightmares from my PTSD and my social extreme anxiety and a lot of the other things I have going on. And then I end up having this nightmare that we have to get into the basement, Mora and I, because this whole thing is wiped out. And it's oh, geez, that's the last thing I need. And it's not because I'm watching too much news or anything. It's just, you have a headline come across like that, and you're and then sometimes your mind just goes, further than it I don't want to say further than it should, but just it takes it in a different direction, if you will, and it's no, I don't want to sound like I'm crazy, you're not crazy at all, Dr. Fox. Even though when we're younger, this is why I couldn't get the help back then, because it's, oh, you want that? Well, then you're crazy. We got to throw you in a mental institution. Even though, even to this day, we get a lot of horrible, gross, disgusting trolls online. And a lot of these heterosexual, homophobic men out there, and women, will say, you have a disease. You need to be thrown into a mental institution. And it's what kind of horrible, gross, disgusting past deserves for you to push yourself to that point? And, of course, they're going, hey, look at that. I'm getting attention. We're not bringing attention to you. Notice I'm not using any names. But it's just that this is, and of course they can hide behind their anonymity and they can say whatever they want online and they get their jollies off on this. They're oh, look at that. I know how to push so-and-so's buttons. Awesome. I can just keep saying horrible, gross, disgusting things and keep pushing them, see how far. Maybe eventually they'll just kill themselves. It's going to take a lot more than that for me to kill myself. Trust me. I've come close before, but it ain't because of any of that crap. That's maybe 10-12% of what I have to deal with, but it's frivolous. Even if that wasn't there, I have so many other things going on that I'm more worried about that other crap. It's gonna take a lot more than that. So McDonald's. Well, it was National Sandwich Day yesterday, so if you spend $1 and thankfully you can still get any size. So I get a full unsweetened tea, and you get a free Happy Meal. So that helped. But I'm going to kind of wrap this up. I think I'm already over a half hour again. So I just wanted to spend a little time with you, kind of share with you a lot of the chaos that's going on, kind of how I've been feeling over the last 6 weeks. Like I said, there's pros and cons. There's a lot more to say. I could spend hours talking about this stuff. I just wanted to touch a little bit on the psychological part of it, the outside negativity that you constantly still get, no matter how much money you spend. I mean, this is the outcome of over $100,000 already, and I still got more to go. And insurance won't cover it, and yet they said, well, we'll cover it, but it don't cover. They're not covering it the proper way. They're putting you through all these channels, and then they still won't cover it. And they tell you, well, we don't work with those surgeons. And they're well, you got to do your research. I did all my research. I have talked to surgeons from Thailand, Iowa, Wyoming, California, Washington, Canada, Boston, New York, Florida. As I said, those two different ones there in Canada. I've done all my research. I can't. They all. I don't know how this is working. I like to know because I've tried Aetna. Like I said, I've had 12 different insurances, and then you got to wait. Then you got to patiently wait on top of that, and people wonder why this takes so long. And even when you do all your research, like I've gone through all these insurances, and then some of them you have to be on it for over a year and a half before they'll offer that coverage, or they'll put you through a lot more hoops. I don't know how this young girl. I wish I could talk to her. I don't think I've seen her even post a YouTube video in over a year, and I understand why. But it'd be nice to just have a conversation with her about this stuff. I'm not trying to get more views. I'd just be nice to have a conversation with someone else who I'd like to see. I know she did a couple of videos about like the surgery and GRS and stuff, and she just talked briefly about the insurance. And maybe I just missed one of her other videos that she went more in depth on it for, but like she touched on it briefly. Now I know obviously some people don't want to share all those pieces, but I'd be curious which insurance, because there are countless websites out there that will give you all the trans help, and there's Transforms, and there's like Pink Essence, and there's a whole list of other places you can go. And I've tried all that, and I've been in with a local, the local non-for-profit. That's why I ended up starting my own. Didn't even make me feel comfortable. In the early days, they did. They actually wanted me to be president of their group for quite some time. And I would have loved to. I just, at the time, I was taking on too much. And it's a lot of stress for me to take on such a thing. And it was a lot of responsibility that I just couldn't. I knew I could handle a lot, but I just knew I couldn't take on those other aspects. Especially, I knew, too, at that time, I did not have very much money to survive on. And I'm not saying you can't run a non-for-profit when you don't have much money, but I had a lot of other things going on. So I can't just go to them. I can't just call a crisis line. Trust me, sometimes I feel like the way they've been trained, and I know how they've been trained because I know how all those pieces work. And I know some mean well. And again, everything I share with you there's always an exception to every rule. But the majority of them, when I tend to call, they make you feel like you want to just kill yourself. And all kidding aside, they're just not as, that's not the kind of compassion you want. Now, let me reiterate something, though. That has helped many that are on the premise of going. The way that some come across, it makes it very complex to make that phone call. And then, yes, I'm supposed to have access to a therapist, and I'm supposed to have access to 2 or 3 others. And don't get me wrong, there's been a couple of nurses that are like, if you need to talk, I'm here. And I can't just call them up willy-nilly. First off, I don't know their extension. And I'm very good with faces. I can't see them, but I am pretty good with voices. But names, I don't do very well. And yeah, I could write them down, but then I forget, or I wrote them down. And I put them in my phone, and I forget I have them in my phone, or where to find them in my phone, right? Or where to find them. And then we know it's more complex than that. And I'm not saying that people go, we're just making it more harder than it needs to be, Dr. No, I'm not. And if you understood where I'm coming from and what my chaos is, you're only getting pieces of it. You're getting a piece here and a piece there. And so people are quick to put together and go, I don't know why she's complaining so much. She's got do. And that, it's not complaining. It's not, and someone go, you should just be grateful you're alive. I am grateful I'm alive every day. This has nothing to do with being grateful or not being grateful. This is not about any of this stuff that most people like to label you with. And sadly, many times, ever since as young as I can remember, I'm being labeled for the wrong things. And people misinterpret it. And they're quick to judge. It just... And I'm not sitting here trying to be like a Karen or negative Nancy or whatever people want to call that term these days. Because when we grew up, it was a different term. I've never, ever been like that. And I'm like, how do you say, like, I'm not telling people what to do. I'm not asking everyone to be a saint. I'm just asking for a little patience, respect, tone down the attitude. Is that so much to ask? I'm not telling people what to do. I'm just asking for a little bit more. The world would be a little bit kinder if we just took a little more consideration for one another. And then a lot of people are very angry and they can't say that because they're like, well, people don't give me consideration. So what, because, treat as you want to be treated. But here's the problem. 100% of the time, I treat people how I'd like to be treated. And probably about 92% don't return that kindness back to me. They're very angry. They're quick to judge. They just it. You'd think you'd want treat as you want to be treated. So I treat people as I want to be treated, and then they don't return. They don't reciprocate that, and it's really struggling. And I think I'm already crossing over 40-minute time frames. I'm gonna kind of wrap this up for the day, but these are things I wanted to share with you before I wrapped up for the day, and kind of check in, share with you, what's going on up here, how I'm trying to deal with everyday life, how physically I'm starting to now feel and look. I hope that's given you a better idea while I just sit and babble. I'm not babbling, but you get what I'm trying to say. And I think with that, let's take a couple of things, kind of, step back for a moment. See, that helps. Take a couple of those deep breaths, and then we'll think about things. And remember to call me next week. Call me in the morning. Call me on my weekend update. Right? Ha ha ha. Just kidding. It's a play on words, really. It's not about actually calling me. It's funny. I don't know how many times I'll say that on my videos, and then all of a sudden I'll get a phone call. I'm like, what? Did someone just see my? No, it's just because randomly this phone call is coming in. It's just kind of funny how sometimes it lines up. Anyway, I think with that, let's take those two things. Let's kind of step back a little bit, contemplate that. I hope you all stay safe this week. I'll see you all soon on my weekend update. And once again, we will see you later. But before I go, as a one last present I want to share with you. Sorry, it's a little shaky. I'm going to share with you my little babies. Mama's babies. Mama's babies.